Hey guys, so I just want to talk to you for a few minutes about heart disease. So I had a new client that came in, called me up, was referred to me by one of my good friends in Florida, so she's in town. Told me that the doctor said she had congestive heart failure. Believe it or not, with some 69 million people around the world that have heart disease, and not to mention the huge numbers that die, that make coronavirus nil in comparison in numbers of heart disease on a yearly basis, it really isn't that complicated. It becomes complicated when you look at how we're being diagnosed and what we're doing to try and help people with heart disease. And so there are two things I just want you to recognize and keep in your spirit. And for those of you who are not subscribed to Ask Dr. Dallas channel on the Imagine BC app, this is where you get this information and a whole lot more. But because I love you all and I want your hearts to be well, I'm going to just give you this information. So many of you who've come to my lectures know that depending on where your pain is, when I have clients that call me from the West Coast if they've got pain, and I say, okay, what knee is bothering you? Or they've got a headache, is it the right side of your head, is it the left side of your head? What you need to understand is that we live and die at the cellular level. And so you have a cell, if you can imagine, and it needs to stay in balance. And when you talk about the body healing itself, it starts to heal itself when the body is brought back to balance. So as naturopaths, we don't heal you, we simply bring your body back to balance. And when the body comes back to balance, the body has this incredible ability to heal itself. So what are we doing when we bring the body back to balance? We're trying to keep the cells in balance. So with your cell, you have water on the inside of the cell and you have water on the outside, or fluid, I should say. So you have intracellular fluid and extracellular fluid. The intracellular fluid predominantly is controlled by sodium, the potassium. The extracellular fluid that carries around the cell is predominantly sodium. And so we're going to talk about the best source of sodium and potassium, and that has to be an organic source. Not organic based on the way you grow things, pesticides or non-pesticides, but organic meaning that the element has hydrogen, nitrogen, and oxygen. And so the best organic source of potassium for the intracellular fluid comes from carrots. The best source for the extracellular fluid, the sodium content, would be that from celery. So dividing the body in two, you have the left-hand side and the right-hand side. The left-hand side of the body is predominantly controlled by sodium. The right-hand side by potassium. So if I have a pain or ache or something going on the left-hand side of my body, more than likely it's a sodium deficiency. On the right-hand side of the body, it's a potassium deficiency. And that's how I deal with a lot of things from a question-answer standpoint. So for those of you who want to come in and do a virtual consultation versus the in-person, I mean, just asking your food questions is going to really help me kind of pinpoint what's going on with you. But we're talking about heart disease. So how does this become tricky? I just said that everything on the right side of the body is controlled by potassium. Everything on the left side of the body is controlled by sodium. However, you have your various organs that have elements associated with them. The heart is basically a potassium element. But where's the heart located? The heart is located on the left-hand side of the body. So you've got a left-hand side thing that's controlled by potassium. And this is where it gets tricky, because the best thing that you can do is to give the heart a good source of sodium and potassium. Now, when you go to the doctor because you're having heart palpitations or your arteries have been clogged or whatever, how are they getting this information? What does this information come to them as? It comes to them as inflamed arteries. What causes inflammation in the arteries? Usually allergic reactions to food. Now, I personally don't get into allergies per se. When we talk allergies from a naturopathic standpoint, that's simply a nutritional deficiency. What nutritional deficiencies do you have? It depends on whatever else is going on in your body. But chances are potassium, sodium, magnesium, silicon, or iodine. Those are the top ones. So when you go into the emergency room, even when you're unconscious, you're getting an IV, all of a sudden we feel better, we come back to life. Why? Because if you look into that IV bag, it's either potassium, sodium, magnesium, calcium, those things that I just mentioned, and it's given to you intravenously so that it can get into your bloodstream immediately. And so that's what we do with our T blend. Our T blend has so many great things that have the potassium and the sodium in it, so that you can take this liquid concoction on a daily basis and literally cleanse and heal your body. So that's the main thing that's going to bring my client to a state of balance. But what you need to know is that when you do eat something that the body has a negative reaction to, primarily because there's a mineral deficiency that already exists and it causes this inflammation in your arterial stimulants, what's going to happen is it's going to look like you're having a heart attack. It's going to feel like you're having palpitations. You go to the hospital, they may very well operate on you. Not because you have a heart attack or you're having a heart attack, but because you have a condition where there's a deficiency and someone's giving you something else. What else are they giving you? Because you're going to leave there with some medication. What type of medication are they going to give you? They're going to give you some medication that has potassium in it because the heart needs potassium. The problem is it's not going to be an organic source of potassium. It's going to be an inorganic source of potassium. What's an inorganic source of potassium? That would be pharmaceutical, whatever, grown in a lab. That is not what's coming from the carrot that grows in the ground, that is a part of a whole and pure food. So you're not going to get the same type. It's just the example I give all the time. If my arm is amputated, I need a new arm. How am I going to look with a 6-month-old baby's arm on me? It's an arm, I need an arm, but it's not the arm that is going to have the best functionality with the big old body that I have versus a 6-month-old body. That's probably not the best example, but work with a sister. You're just talking about, it's more synonymous with, if I'm going to give food to a plastic plant, really, why give plant food to a plastic plant? You know, or real food to a doll baby. And so that's what we're talking about. It's talking about inorganic versus organic. And so what they're going to give you is an inorganic source of potassium, and that's usually potassium chloride. Potassium chloride. And what does the potassium chloride do to the stomach lining that needs hydrochloric acid to be able to process the foods in order for you to be able to digest them, to keep your body from growing parasites and going into all kinds of states of shock? Kills it. And that's just what it does to the stomach. We're not even going to talk about what it does to the heart itself, because it's giving it a false sense of fulfillment in terms of getting potassium. You're giving it potassium chloride. That is not the same thing, and is not going to do the same thing. What it's going to do is probably increase your chance of having heart failure. If you look very closely to the heart medications, the 3, I'm not going to name them because I'm not trying to be sued, but if you look very closely to them, at the end of the very, very long list of side effects, you'll see heart failure. Duh. I mean, so go figure. You're taking something that could potentially cause heart failure that is supposed to help your heart. So I think that's enough said. So just keep in mind, and I would say that if you are having some problems, and say if you have problems in both of your knees, then what would you be doing? You would be doing carrot celery juice instead of just for the left knee or for the right knee. So what would that come to look like in a natural deduction? I would say that I would be doing carrot and celery juice just because I know what it does for the human body on a regular basis. So I hope this has been helpful. I hope this will help you get to your local health food store and get you some organic celery and some organic carrots. Now that is the way that it has been grown. So we talk about the organic sodium and the organic potassium that is within the carrots and the celery, but now I'm saying actually go and buy you some organically grown celery and organically grown carrots and juice them up, and just have yourself 8 to 16 ounces on a daily basis and watch what happens. Work closely with your doctor so that you can wean yourself off of the high blood pressure medicine and any other thing that you're taking. Let them know what you're doing and what you're going into. But trust me, this is one of the best decisions that you can make. And the greatest thing about it is that it really doesn't take a long time to turn it around. We have some really other good 2 and 3 day detoxes that you can do during this time of the year, but that information you're gonna have to get on our channel. So once again, go to the Imagine BC app, look for Ask Dr. Dallas channel, and subscribe, and you'll get this and a ton of other information that will keep you healthy so that you can enjoy your grandchildren and everybody else for many years to come. Take care.